Mayor Lightfoot, I'd like to recognize myself for 5 minutes of questions. Mayor Lightfoot, I understand that Chicago has taken a data-driven approach to its vaccination program, and I'm fascinated by this at-home vaccination strategy. Can you explain some of the lessons Chicago has learned and how it has changed its approach based on what it's learned?
Well, I think one of the biggest things that we've learned is that there's not a one-size-fits-all approach, particularly when you're dealing with vulnerable communities. We have really spent a significant amount of time building partnerships, joining tables that have already been built, and really then using the data and sharing that data with local-based advocacy groups and stakeholders to craft really neighborhood-specific interventions. One of the ones that really came out of that discussions is our at-home program. We started that using Johnson & Johnson to go into homes of our seniors, but we've seen such embrace of it across particularly Black Chicago on the south side, where we've seen lower rates of vaccine uptake, that we've been literally going door to door with vaccine ambassadors and then signing up whole households for the at-home service. It's really been quite tremendous with us. But what I would say is, again, is one of the things that's been most important in our vaccine distribution program is the work that we did prior to the time that the vaccine hit, by building those relationships with trusted community partners and messengers, and then using that infrastructure to push out vaccines, and then constantly being engaged with them to understand what the levels of hesitancy are. I think Dr. Ezike got it just right. Based on polling that I've seen both nationally and surveys here locally, there's a small percentage that are anti-vax, that are never going to reach it. The vast majority of people that remain unvaccinated are still vaccine hesitant. So when we send out those ambassadors into neighborhoods, going door to door, we see the ability to really address people's concerns, make sure that we're informing them of the facts, because as you know, there's still a persistent drumbeat of misinformation out there about the vaccine, about the efficacy of it, what the ingredients of it, what was used, and so forth. When we're able to have those kind of one-on-one conversations, we're able to break through at remarkable rates.
Thank you. Dr. Ezike, rural areas. It seems like this is a really tough nut to crack. Can you tell us what is working in rural areas, and can you give any specific examples?
We have tried the door-to-door method that had worked in some areas, and we had a lot of pushback and resistance on that. So what we have done, we've continued to do outreach. We've continued to partner with churches in the area, try to find local people of faith who are willing to share the message, allow education to be spread, host events. But we've also had to make sure that we give other options. And so we have been very diligent about educating about monoclonal antibody. We know that at the end of the day, we need to save lives. And if we have people that are still on the fence, still hesitant, or absolutely not going to get a vaccine, part of the approach has to make sure that they do understand how they might take another option if they were in fact to get infected. Although we continue to promote an ounce of prevention is worth a pound of cure. We've also tried to make sure that there is access.
If I could jump in, are there any trusted organizations in the rural areas or trusted messengers that seem to be more effective than others?
So we think that using physicians from the local area, people who are recognized by people in that area, we have a strong rural health department at IDPH, and working with those physicians who are in the community, helping to have the town halls where people can ask the specific questions that are maybe holding them back. And when they see a physician or a nurse practitioner, another clinician that is known to them, that's from the local community, sometimes that correct messenger is the person whose message will be received.
Now, Mayor Lightfoot, what do you think? Who do you find to be, if there's like a group or a class of people who are the most trusted messengers that you've found, who are they?
I think it's those local healthcare providers first and foremost. But what we've also been able to deploy is people themselves who are vaccine hesitant, who then can tell the story to others about what it was that really got them to decide, no, the vaccine is something that I need for myself and for my family. Those are very powerful messengers.
Excellent. Thank you. Now I'd like to recognize Congressman Foster.